we don't really have a vision for health in this country beyond like Medicare for all, maybe, which feels, even that feels visionary and like dreamlike. At least we're told that constantly. Oh my God, then you'll want a pony. So, but you guys are really talking about reevaluating what health means in this country. And please explain, why do we need to reevaluate health?
I think right now the left is just underexposed to some of the critiques of health that we have, especially that would be really valuable to our movements and just to the way that we sort of think around politics. If we think about right now, the average person they have maybe employers sponsored health insurance if they're lucky. Most people don't. And even when you do have that kind of wonderful insurance, I don't think that there really is a guy that loves their insurance. I think that that's a kind of made up, that's a made up person. But I think that ultimately, most of the ways that we use our healthcare is really to kind of make sure that we're still able to earn a wage. Like if we think, obviously we're sort of getting care, but so often people are either going to the doctor to get a note to prove to their boss that they deserve the sick day, or they're going to the doctor to be made more healthy so that they can be a better worker. And so much of the ways that we talk about health and think about health on the left is just really limited to maybe a single nation intervention or ideas that sort of build on this idea of health being about maintaining your labor power in the way that, kind of we already think of it. So I think that there's just a lot more that we can work with if we stop for a moment and sort of interrogate some of the things around even what health is, to really question, is there such a thing as a healthy person, right? Like if we're all living under capitalism and health is about being a good worker and making yourself available for extraction of surplus value, do we even want to be healthy under capitalism, right? And is there a way to think of health that goes beyond some of these frameworks that we know very well, but we also know so well just how miserable they make us and how much suffering comes as a result of some of these very specific decisions about how we're going to think about certain things, and health, and who pays for health and who deserves health care is one of the things that for a very long time the left has had a very limited take on.
Now, what do you think is the role of the practice on the left of carrying a water bottle at all times in terms of capitalist accumulation? See, Exhibit A. Oh, you too? I just have a stormtrooper glass.
Wow.
A stormtrooper tiki cup with water in it. Thank you very much. So do you, when you talk about like that sounds like a fairly pervasive critique that like health and capitalism are infused in every, like, can you talk some, I mean, in your book you sort of articulate a vision for a way forward. Like, is it possible to have health in a meaningful sense under capitalism, or is this like we need a revolution? Do you have an idea about what some people would call non-reformist reforms that can happen where we are?
Yeah, absolutely. And I think one of the things that's kind of funny about the water bottle example is it's actually a good, I know you were joking, but it is actually a good
I'm serious as a
example.
motherfucker about water.
I'm all for hydrating, but if we think about some of the ways that we keep ourselves healthy, right? Like it's all oriented around people's individual behaviors. Like, are you drinking enough water? Are you being a good consumer and making sure that you're not buying disposable water bottles that you're throwing away? So much of the way that we even think about engaging in like environmental politics is also translated through this consumer frame in a very similar way to the way that we see health, where it's like, you're responsible for your health, get your vaccinations, go to your PCP, stay on your medications, and you will be a better worker for it. And so a lot of the things that comprise health, I don't think that under capitalism we can actually have it, because I think part of the point is that health is always supposed to be unattainable. It's like an aspirational goal. And it's really up to people to kind of better themselves towards that as a way of like gaining more value in the labor market. Like so much of like how we even conceptualize like what a healthy person is, like usually that's someone who's athletic and exercising, maybe they work out, you know, they've got like they're thin, they have their water bottle, they
Andrew
do
Tate,
yoga.
you just say it. Yeah, Andrew Tate.
You know,
yeah,
oh, I'm actually
completely.
thinking more of like the wellness bitches, like
No, yeah.
you know, the kind of people who are like, okay, you know, I have like all of my wellness routines and like my goal is to sort of construct like health around me. And I totally understand the kind of impulse because so much of, you know, our healthcare system is really cold and kind of unforgiving and doesn't make people feel welcome. But I think part of it is that we have this dogma that like your health is up to you and it's about your choices and it's about you making the right choices, whether that's picking the right yoga class or whatever, or picking the right doctor. It's really like all around this very individuated understanding of what health is, when ultimately whether or not you get asthma has less to do with you working out or your genetics and more to do with like what factories were you living around when you grew up as a child?
Yeah.
What
Well,
city did you grow up in? You know, I grew up in LA.
What's up?
Before smog was like a huge problem in terms of like conversation, right? Like it was something that I think in the early 90s when I was really little, like was just starting to be talked about, right? Like that we were being exposed to these environmental toxins and we needed to start checking cars, right? And it was up to everyone to make sure that they got their smog check on their car to do their part. But fundamentally, like everyone getting their car smog check doesn't fix the problem of extractive capitalist industries polluting the air that we breathe, right? And so ultimately, this is an idea that actually really does already exist called the social determinants of health, which is like you can only control so much about your own health. You can work out all you want. It's not going to save you. And I don't think that you can be healthy when we live in a world under racial capitalism, which is a global system, and all oriented towards this kind of directional extraction from poor people to people with means. And I think that that fundamentally makes both health unattainable for people of a certain class position, but it also, you know, does frame health as something that is not a right. Even though we like to talk about health as a human right, I don't think that our political economy actually reflects that.
Yes.
And so, you know,
I want to jump in and just say just a little like yes, and you're very excited because I have so many.
I just want to jump in and say yes.
Yes, and you know, breaking all that down, you know, high theory, but just yes, and because it is a way to privatize the cost, right? And once again, the capitalism is so good at doing, and you know, socializing the cost and privatizing the gains and all that, and the way that it is on you individually within the most narrow confines of the privatized healthcare system to get well. And I'm in the middle. We've got great healthcare right now, supposedly. I mean, PPO, whatever, that we buy on the effing marketplace that is so exorbitant. And you're just on hold for your meds for forever, you know, like, and you get ping ponged around. I just had a baby. The shit is just like, it is absolutely insane. The level of like the way that you get pinched and prodded, and the fact that I like paid money for a vaginal birth, you know what I'm saying? Just like all the ways I'm still paying for this. And yet you're being told that you have the choice. It's all you. It's your choice to be healthy. Your choice, your choice, your choice. Oh, you know what you don't have a choice over? Whether or not you have that kid. No, we're going to take that right away completely, because it actually, we want little worker bees who are unhappy and are unable to do anything but work in our Amazon warehouse that is not unionized. You know what? Like it's this whole beautiful, disgusting system.
Which also Amazon has like 3 times, I think, or 2 times the rate of average injuries compared to other similar factory layouts. And I think you see this kind of disposability of people, but also this thing where like people are blamed for not having their health. But as we've been saying, like so much of it is out of your control. Like if you work a job that prevents you from sitting on hold with your fucking insurance company for 12 hours to get your monthly medication, is it really on you if you're not taking your meds anymore?
Right.
Or is it on
Absolutely.
us? Because I think it's really on the system. And we talk about things like and blame people for all sorts of things. We call patients non-compliant when they can't afford their medication. And I think, just these frameworks and understanding what the point is of sitting on the phone. Your experience, it's very common and it's by
Yeah.
design, and
Yeah.
it's called an administrative burden. Have y'all heard of this before?
I mean, no, but yes.
I mean, it's pretty self-evident. Like, it's an obvious name, right? But it's a health policy design tool. So you implement administrative burdens like paperwork that has to be
Mhm.
delivered by a certain time, prior authorizations, these kind of systems. What they do is they meter access to care.
Right.
They're intended to weed people out. It's intended to reduce demand. We have this very sickening thing in the United States, to your point about non-reformist reforms, where we see a problem in healthcare and we go, for example, oh my God, everybody is under or uninsured, right?
Mhm.
And we have the ACA. Now everyone's underinsured and
Mhm.
everyone's like, we have to get costs down. Well, how do you get costs down? By rationing healthcare, by kicking people off of Medicaid, by instituting administrative burdens that are going to slow down the demand, because we have more demand for healthcare than we can provide, because we have spent decades in the United States privatizing our safety net hospitals. Doctors' offices have consolidated. We're seeing, these huge shifts where things have gotten more private. Private equity has gotten more control over the health sector. And so what we're actually seeing is like a moment where if we were to pursue a fix for our health system to reduce costs, it would be fucking brutal, right?
Yeah.
Like,
I
it
mean,
would be deadly.
the most, undeniably, the most effective cost containment measure our healthcare system could adopt is to let people die.
Yeah. And
Like
that's what we're seeing with COVID.
nothing
Yes.
saves money faster than letting people die. Beatrice, I feel like the way that you're talking about health in terms of keeping people as productive workers, rather than sort of understanding health in terms of people living full lives under capitalism. I feel like you're sort of like there's something that you're alluding to about the place of disabled people in capitalism. And
Mm.
could you just sort of say it more explicitly?
Yeah, of course. So I'm disabled. I'm certified by the government, officially disabled, have the stamp, got the
Mhm.
official memo. The way that I was certified was that I proved to an administrative law judge, not that I was sick enough to be disabled, but that I was sick enough that it prevented me from working. And
Mhm.
not a lot of people actually understand this. Our disability support system for folks who are disabled and working, they can't access SSDI. They don't get Medicare. They don't get the kind of disability benefits. Disability benefits are for when you're not working. We have a different definition of disability for the Americans with Disabilities Act, because that's about disabled people who are working. So if you can be accommodated in the workplace and that could make you able to work, then you qualify as disabled under the Americans with Disabilities Act. But if you were able to prove that you could work and therefore are deserving of accommodations, you're proving that you're ineligible for SSDI.
Right.
So we have these two different frameworks where we say, okay, like the disabled people who deserve the ramps, who deserve the workplace accommodations, those are the working disabled people. We're going to prioritize those sort of interventions. And for people who can't work, we have, this safety net program, which I would not be alive without, but which, thousands of people die every year in the wait list just to get through the process of the application. And then after you get approved, it took me 5 years to get approved. And then I had to wait 2 years for my Medicare to kick in. So additionally, while there's like this huge drop off rate and people die when they're trying to prove that they can't work anymore, just for like, a fucking meager amount of money from the federal government every month, and traditional Medicare, like the bare minimum. Your income is capped. You can't make money anymore. You can't work, or else you'll lose your health care. And so we really sort of say, so the only people who are deserving of socialized payment for their health care are the people that are not profitable markets, like
Right.
non-working disabled people, people over 65. If you actually look back to, sorry, bear with me. If you look back to like the era of the Black Death, you know, right before the emergence of capitalism, you have, and we talk about this in the book in our chapter called Labor, you have the introduction of a couple novel frameworks of who deserves to not work in an economy. And that hasn't changed much at all since the 1300s. It was at that point people over the age of 65, people who could prove that they were disabled through no fault of their own. And so it was the first time that it made not working illegal.
Mm-hmm.
And it also exempted property owners, of course.
Jesus Christ.
When you start to think about, oh, they're going to raise the age, they want to raise the age of retirement for Medicare and Social Security another 5 years, right? To think back that, like, you know, even back during the Black Death, they wouldn't have done that.
What's going on, Frantifa? If you haven't already, subscribe to this channel right now. Hit that button. And also, you can become a patron and support the show every single week. Get access to bonus episodes and exclusive merchandise. Patreon.com/Bitchuation Room. Do it.